सेफ्टी हो गई क्योंकि चेयर से उतार के हम नीचे ले आए हैं. नाउ द सेकंड स्टेप इज विल चेक फॉर द रिस्पॉन्स. अंकल अंकल ठीक हो? कोई रिस्पॉन्स नहीं आया, ही इज अनरिस्पॉन्सिव, राइट. सो नेक्स्ट स्टेप वुड बी कॉलिंग फॉर इमरजेंसी बिकॉज आई विल जस्ट bridge over the time, but ultimately I have to take him to the hospital. So I'll call on 108, पंजाब का नंबर है. कहीं और जाएंगे 101, 102, एम्बुलेंस में भी कॉल कर एम्बुलेंस के लिए कर सकते हैं, फायर स्टेशन में कर सकते हैं, कहीं भी कर सकते हैं. दिस इज एन इमरजेंसी सिचुएशन. सो उनको बताएंगे हेलो वी वर हेयर, मतलब उनसे कंफर्म करो कि इज इट 108, हो सकता है कुछ और हो. देन विल कंफर्म देयर वाज अ पेशेंट in a CME RG hospital ground basement. The patient has fainted, not responding. Could be a cardiac arrest. Could be a cardiac arrest. Please come with AED and ambulance for help. Right. Then after this, if I can check, so I'll check for pulses. How will I check for pulses? Lift the head. There is a thyroid cartilage या Adam's apple जिसको कहते हैं, उसको टच करके will slide down towards the side. यहाँ पे will feel a groove. डिप्रेशन मिलेगी. सो वहाँ पे प्रेस स्लाइटली यू विल फील अ पल्स, समथिंग पल्सेटिंग और टचिंग योर हैंड एवरी सेकेंड. More than 6 seconds, less than 10 seconds. We don't want to waste too much time. So I'll check for the pulse. Simultaneously, I look for the chest rise. 1004, 1005, 1006, 1007, 1008. So 8 seconds, no pulse palpable or not breathing either. Okay. Now I'll start with the chest compressions. For chest compressions, we'll use the heel of our hand. Right. So heel of the hand will place in the lower third of the chest bone. So this is our chest bone. इसका यहाँ पे खत्म होती है. तो just above this we'll place our heel of the hand. So heel of the hand here, supporting with the other hand because we need to push and give force. I'll come straight over to it. तो 90 angle बन जाएगा patient के साथ. I'll start with the chest compressions. So chest compressions would be 30 compressions at a stretch, then at a rate of 100 to 120 compressions per minute. Right. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 26, 27, 28, 29, 30. So if you see, while I was compressing, chest went inside almost 2 inches and approximately 5 centimeter. And after the compression, I gave time for the full recoil. These are important steps because if you don't allow chest recoil, there will not be any blood to be pumped. So the heart needs to be recoiled, blood comes in, then we pushes and the blood goes further, right? So that is why the rate and the speed of this. Then after the chest compressions are done, 30 compressions, now we'll go for breathing. So for this, again I'll use this for lifting the head. This is head tilt and chin lift, right? So with this I can also pinch the nose, and then straight away with my mouth I'll push in air in two breaths within less than 10 seconds time again. So इसमें होता है 10 seconds से कम time use करना for any interruption we do to the chest compressions. Pulse check की less than 10 seconds, breaths देंगे less than 10 seconds में. So ideally it is 5 seconds or 5 to 6 seconds में we'll give all the breaths. So like this, and तो इसमें नहीं हो रही है, but इसमें अगर करेंगे तो we'll see a chest rise here, right? Then again we'll start with the chest compression in a similar fashion. So this will continue for 5 compressions, 5 cycles of 30 compressions each, right? After these 5 cycles are done, again we'll go back to checking the consciousness or checking the pulse. अगर आप pulse check कर सकते हैं तो priority is pulse. If you don't know how to check a pulse, then check for the consciousness. If he is conscious, then we stop here. If he is not conscious, we start with this cycle again.